Welcome to West Coast University Medical Center, where we are ahead of the curve. Here, we are proud to call ourselves a state-of-the-art teaching institute, leading the way to educating the bright minds of medicine and nursing. This video is designed to give you, the prospective nurse, a snapshot of West Coast University Medical Center. We will discuss who we are and what we can offer to the new graduate nurse, as well as the application of the nursing care team here within the medical center. We will discuss our mission to maintain a zero assaultive behavior cases against the nurse and associate staff, as well as our incentives for you to succeed in nursing. Lastly, we will discuss our roadmap to accreditation to magnet status. So, who is West Coast University Medical Center? We are a new teaching hospital located within the Inland Empire, first associated with West Coast University's School of Nursing. The medical center is dedicated to learning and researching for best evidence-based practice and its effect on the patients. We work collaboratively with all areas of medicine and nursing to provide a holistic approach to health. So what is West Coast University Medical Center all about? Well, we want to be the forefront of the science of nursing and initiate a movement designed to help the nurse as they are the faces of the hospital. We are the first of its kind, dedicated to the patient and nurse relationship, as well as the holistic health of the patient as well as the nurse. We have the innovative new graduate nurse residency, as well as nursing care teams and safety management. We encourage educational advancement with possible financial incentives for the nurse. We work with different parts of healthcare, including medicine, occupational therapy, physical therapy, and pharmacy, just to name a few. We hope to inspire other institutions to treat their nursing staff as the faces of the hospital and should be treated the same way the nurses themselves treat the patient. We believe that nursing is a profession where the individual is consistently growing, learning, and maturing within their practice. Our new graduate residency is catered to applying general nursing knowledge from school into practice in the acute care setting. We accept applications year round and we have placements in the emergency room, intensive care unit, pediatric intensive care unit, neonatal intensive care unit, and medical surgical units. We have instructors from both medicine and nursing concentrations and promise to keep a position for the new graduate resident after a year residency. We are partnered with the UCR School of Medicine and are dedicated to both the science of medicine and nursing. The nursing residents work with medical residents, occupational therapists, physical therapists, speech therapy, and pharmacy residents. We have 4 workshops annually where case studies are applied and discussed to all areas of healthcare. This nurtures a cohesive medical care team for the patient in hopes of creating a healthy environment where different areas of healthcare can critique and learn from other areas of healthcare. Here at West Coast University Medical Center, we implemented a nursing care team with every patient on the floor. With every registered nurse, there will be 1 LVN and 1 certified nursing assistant. Each RN, LVN, and CNA work collaboratively together to discuss the best plan of care within the respective scope of practice.
This encourages learning from different disciplines and nurtures respect from all aspects of nursing. Team building with each nursing care team helps develop a sense of responsibility for the RN, as well as collaborative learning for the CNA and LVN. We care about the safety of our nurses and want to eliminate nurse-related assault within the hospital walls of West Coast University Medical Center. Each nurse will be equipped with personal alarm systems that is directly transmitted to the security team in the hospital. Nurses, as well as any member of the healthcare team, will be trained upon employment on managing assaultive behavior. Outcomes have shown that this has virtually eliminated workplace violence for the nurse. However, we are fully aware that there is verbal violence within the workplace as well. Nursing leadership will be encouraged to mediate between nurses or any member of the medical team as part of their scope of practice. We encourage our nurses to grow within the hospital setting, and we want to nurture an environment that is conducive to the growth of every nurse. West Coast University Medical Center plans to reimburse any payment towards certifications once the nurse has passed all applicable exams and tests. In addition, any nurse that wishes to advance their education will be able to retain their position as a per diem staff nurse while in graduate school. Scholarships are also available for nurses who wish to commit to a master's or doctorate in nursing. As we encourage the nurse to increase their knowledge and practice of nursing, we also want to acknowledge that a great nurse is a healthy nurse. We have diet and exercise programs that work in conjunction with the medical center. Each nurse is encouraged to use the on-site gym facility and learn weight-bearing exercises that can improve the health of the everyday nurse. This will also help them with weight-bearing tasks that nursing calls for. Dietary consults with dietitians can help the nurse manage their diet and eating habits. In addition, by educating the nurse about exercise and diet, the hope is that the nurse will use their knowledge to impart on their patients.
We are working towards magnet recognition from the American Nurses Credentialing Center. A magnet hospital shows excellence in nursing practice and includes several different components. Transformational leadership states that nursing leadership all demonstrate advocacy and support from staff and patients. Leadership is dedicated to implement evidence-based practice through innovation within nursing. Nurses will feel that their voices are heard and valued. With structural empowerment, nurses will have a voice heard in decision making and help establish standards of practice with hospital leadership. They will serve on decision making bodies and help them provide excellence in patient care and safety. Exemplary professional practice will help create a culture of safety and quality improvement. Nurses will collaborate with other areas of healthcare to create comprehensive, coordinated, and monitored care to help improve quality of care to patients. New knowledge is consistently integrated into clinical processes. Nurses will then be educated on evidence based practice and research, which helps provide the safest and best practice for patients and generate new knowledge for the nurse. Because of all these improvements within nursing, there will be empirical outcomes generated that exemplifies excellence as a magnet certified hospital.
Thank you for your interest in our institution. We hope to see you alongside our amazing nursing team and medical staff at the forefront of nursing.